Alright, so the first test, do the tap or the percussion test. This test for any humor, like you test in the humerus for a fracture. So just relax. So you just go down on your elbow here. You just tap and bump, looking for any like radiating pain that like is specific at one point. Just relax, and that'd be positive for a fracture. Alright, so for the valgus and varus stress test, the elbow, let's have the patient seated here. Do the valgus one first. So grab her arm, place my top hand on the distal end of your humerus, and then my other hand will just go on the proximal side of your ulna. So just go ahead and press in, giving it a valgus force. And as you're looking for any like laxity or pain through her UCL joint, and for the varus, I'll switch sides here. Relax. Same hand placing to my bottom ones, so on a radius. Same thing, give it a varus stress, looking for any laxity for RCL. And then for the valgus varus stress test for IP joints, just same thing, just grab her hand. First one, you just press in, press out for valgus. Just give it a varus force, the other one. Okay, so for Tinel's sign for the ulnar nerve, let's have the patient seated. Just grab her arm, and then I'm gonna just relax your arm really quick. And then you're gonna feel back here. You're gonna find the lateral epicondyle, and then you're gonna find her olecranon. And then right in there is where the ulnar nerve runs, or like the gutter. You're just gonna you just tap in that groove. You're just looking for any like shooting pain through her ulnar nerve, and that's for any like ulnar nerve radiculopathy. Okay, so for the pinch grip test, we can just have the patient seated. Now go ahead, let's relax her arm your leg. Let's go ahead and have her hold her fingers, her two fingers together. We're just gonna pull them apart. Go ahead, do it, and have her do each finger. Go to the next finger. Do each one, go ahead. Last time. And that's checking for any anterior, if positive test would be if she's not able to keep the grip, and that'd be testing for anterior interosseous nerve entrapment. So for Finkelstein's test, have the patient seated. I'll first ask her to just hold her arm out, hands supinated, and I'm going to ask her to radially deviate, trying to just entrap this in here. A positive test would be pain. That'd be positive for de Quervain syndrome or tenosynovitis. So for Phelan's test, we just have the patient seated. I'll ask her to just go ahead and press the back of her hands together. Just press and keep pressure. Have her hold that for 2 minutes. And then a positive test would be any like radiating pain down through her fingers, especially through her first 3 fingers. And that'd be positive for like carpal tunnel. For Murray's sign, you just have the patient seated. I mean, just all you're doing is have them make a fist, and you're checking for that third knuckle, looking for a drop, and that'd be positive for either a lunate fracture or part of her metacarpal could be fractured, causing that knuckle to just causing that joint to just slide down. Okay, so for the intercarpal glide test, just have the patient seated. You just go ahead, just relax. Just have them go ahead and just palpate on her carpals. Get on there. You just kind of move them around, sliding from one to the next. You're just looking for any like laxity or any obvious sign of like a ligament, tear or rupture, and you just go through each one. Obviously, positive sign to be painful too. So testing for any the carpal ligaments being ruptured. So for the elbow flexion test, just have the patient seated, and I'll ask him to go ahead, bring their bicep into flexion. And as they do that, you can even apply like a little overpressure. You hold that for about 2 minutes. Positive sign would be like any shooting pain, especially coming through the gutter, through her lateral epicondyle, and then her olecranon, up into her like first 3 fingers for like the median nerve. That'd be positive for like any median nerve radiculopathy. So for the tennis elbow test, let's have the patient seated. Go ahead and bring her into a little bit of extension here. I'm gonna have her try to push in while I'm pushing out on her, giving her a break test. Go ahead. And then a positive sign would be weakness or pain while going through that range of motion. and that'd be for tennis elbow or lateral epicondylitis. So for the digital Allen test, I'll have the patient seated, and just go ahead. I'll have her, I'll put my hands on her radial and then her ulnar artery. Go ahead, and then I'll have her clasp her fists 10 times. Go ahead. Okay, and hold it. And then I'll ask them, after I'll hold it for a second, and then I'll ask them to release their hands, like so open your hands up. And you'll slowly let off each thumb, and you're looking for the blood flow to flow back through their hand. A positive sign of this test would be if the blood flow does not go in, that'd be for any radial or ulnar artery insufficiencies. So for the hyperextension test for the elbow, just have the patient seated. I'll just passively bring her out. We'll first have her actively do it, just to check. And then you just kind of look for anything beyond 0 for extension, and that's just for any joint laxity or the capsule laxity.